Thank you for being with us. Dr. Quinn, a lot of people are concerned about these mutations and the variants, but the fact is we are seeing fewer hospitalizations. We are seeing a significant decline in deaths. I'd really like to know why the medical community isn't more elated over this data, or what is the warning that they're just I don't know. I feel like we're not saying enough about the positives here. I think people are really scared and fearful that there's going to be another surge. Is that true?
Well, right now, I mean, the coronavirus pandemic has been so unpredictable. I mean, you have to think about it. We got our vaccinations going in December of 2020. We got a lot of people vaccinated. And then the CDC came out and told everyone, if you've been fully vaccinated, you don't need to wear a mask. And a lot of people took this message, even those that weren't vaccinated, to just return to normal. And then we got the Delta surge with this new variant, and so many people contracted coronavirus and so many people lost their lives. So in the medical community, we have to be cautious on our wording and understand that this coronavirus is so unpredictable. And then there's the potential for new variants. So we have to be very careful and just put safety as our number one priority.
But what's the difference between being careful and propagating fear? Because for a lot of people, they've heard the statistics, they know how dire it is, they have a loved one who's passed away from COVID. But in terms of the progress that we've made, that the medical community has made, it seems that there hasn't been a chance for us to really catch our breath with this.
Well, right now, we don't need to really catch our breath and just relax because, as I said earlier, the data showed that in the summer of 2021, this past summer, we were down as far as wearing masks, as far as social distancing, all those behavior modifications that have been helpful. And our vaccination rate slowed down. When the Delta variant came about, a lot of people became fearful for good reason. People were losing their lives. The vaccination rate went back up. But at the end of the day, whatever the mechanism is, we need to get more people vaccinated. But just want to note that we do have some good things around the corner. We may have an oral pill very soon that has been clinically proven to be very effective to decrease 50% of severe illness and hospitalizations and or death. We have children 5 to 11 soon to be possibly eligible for vaccination. So things will get better, but we have to maintain our consistency so that we can maintain those behavior modifications to better protect everyone.
There are some people who might think that if they have the flu shot, then that protects them from COVID-19. How pervasive is that misinformation?
Well, this is a very important message that we're trying to get out to the community everywhere because the flu is a different virus than coronavirus. The flu shot is helpful to help protect you from the flu, but not coronavirus. And it has been noted that the CDC is recommending to get both. They're saying get them in different arms, but you can get it on the same day. And in our clinic, we are giving both vaccinations, and we're giving that information that you need the flu vaccine and the corona vaccine to best protect yourself during this pandemic.
Dr. Quinn, we really appreciate your time. Thank you so much.